Hello, everybody. My name is Michelle Maeda. I'm the pediatric dietitian with the Children with Special Health Needs program. And I'm here today to talk to you about transitioning to adult healthcare. Next slide, please. So what is healthcare transition? Healthcare transition is more than just finding an adult doctor. It's actually learning how to successfully navigate the adult system and utilize it effectively. Now, this topic is so broad that I thought for my 15 minutes today, I would just focus on a few areas. So next slide, Amanda. I wanted to touch on insurance and medical providers, mostly to highlight some information that I found that a lot of my families were really not aware of, but I wanted to focus on the change in the system of care. So next slide. Insurance, really quickly. So we have usually two ways of obtaining insurance, privately, either purchasing directly or through our employer, or publicly, which we would qualify for state federal insurance, which in Hawaii is our Quest Medicaid coverage. So key points, private insurance. 2010, a landmark legislation was passed, the Affordable Care Act. The big thing that it really safeguarded was it allowed children to stay on their parents' insurance until 26 years of age, and this is regardless of their employment or school status. Prior to that, kids could stay on until they were 24, unless if they were full-time students. If they were not full-time students, they were kicked off at 18 years of age. Another thing is if for whatever reason you would like to keep your adult child on your private insurance past the age of 26, there is a mechanism to do that. You would actually have to declare them as a dependent disabled adult, but you would have to check with your human resource department because I'm sure there's paperwork that needs to be done. And I think that there's an age at which this needs to be done by. In Hawaii, we are lucky. We have our prepaid healthcare law. So if you are employed and work at least half time, your employer has to offer you healthcare insurance. So with public insurance, our Quest Medicaid insurance, a key point to know is that once your child reaches 18 years of age, in the government's eyes, they are a family of one. So any eligibility criteria would be based on their income alone. So if your child did not qualify for Quest as when they were younger because it was based on your family income, most adult children would actually qualify for Quest Medicaid. Just make sure that they don't have like big assets, like a big bank account tied to them, because that would disqualify them. Now, if your child currently has Quest Medicaid, their kids' Quest covers them until their 19th birthday. So please check with your case manager to see and make sure that any paperwork that needs to get done in order to change them over to adult Medicaid Quest gets done timely. Big note, the biggest difference between Kids Quest and Adult Quest is Adult Quest does not pay for preventative dental. They only pay for emergency dental. So if your child needs any dental work done, I think you have until age 20. Please make sure that they get that done. Unless you apply for Aloha Care. Aloha Care, I think, is the only healthcare plan that does provide preventative dental. Okay, next slide. So with providers, with our physicians, our pediatricians, and our pediatric specialists, most of them will see patients until age 18, some till 21. Please ask. It's not like if you don't ask, it's just going to go away. If you know the age at which you need to transfer care, it'll allow you to plan a little bit better. How do you find an adult provider? You can start by asking your pediatrician and your current medical providers to see if they have any recommendations. Then, really, I would go with family and close friends. Sometimes knowing the doctor is a big plus. Also, you can check with your healthcare plan and ask for a list of doctors who are accepting new patients under that insurance. With The hospital, Kapiolani Women and Children's Medical Center, is just that. It's a women and children's medical center. They will typically not admit adults past the age of 21. And this is even if your adult disabled child is a female, because their adult care is geared more towards OBGYN types of issues. Shriners Hospital, they see patients until age 21 for the most part. So please double check with them to see if they have any recommendations for follow-up with wheelchair, orthopedics, and prosthetics. Okay, next slide. So like I mentioned, transition to adult healthcare is not just about finding another doctor. Adult healthcare is a whole different ball of wax. And when I looked through different resources, there were a lot of different comparisons. So I just highlighted a few. So with pediatrics is family-centered because they know the child needs care. And especially if you have a special needs child, knowing the family supports and resources would be a big benefit in planning out their health care. Whereas with adult, it's patient-centered. You know, the provider is expecting the patient to be taking care of themselves and taking care of their entire care. Tying into that, with pediatrics, the appointment itself tends to be a little longer. And I think just because they need to get that extra information, and they also have to check their growth and development. Whereas adults, they're much used to a shorter length of appointment. When I look at the primary care relationship with the specialist, I think pediatrics is way more streamlined. And for good or for bad, I think it's just because we have very few pediatric specialists. We only have one or two, maybe in any different area. So I almost guarantee you ask a pediatrician on the Big Island, who's our pediatric neurologist, they're going to know Dr. Abe, or who is our pediatric endocrinologist. But with adults, there are many different specialists in all the different areas. And so there might be that chance that your adult primary care provider does not know who your specialist is. With hospitals, we have one central pediatric center, which I can almost guarantee you almost all of the pediatric specialists are tied into. Whereas with adults, you know, we have Kuakini, you have Straub, we have Queens, you have Polymomi, you have multiple adult hospitals. Different specialists based on where they are going to be tied in to those different hospitals. So when you look at all those differences, it can be a little scary, and it kind of is. Amanda, next slide. But know that we are not alone. When I was looking through like different resources, I found on the Got Transition website, they had a whole little section on finding and using adult healthcare. And these are some of the excerpts that I found, like some from Kentucky. Do you want somebody who will take time with you, or somebody who is good but not have the best bedside manner? And this is from Illinois. They had a checklist, and these are some of the things to ask yourself. You know, does the doctor listen to you? Does the doctor explain? Does the doctor treat you with respect? And really, when you think of it, why is it that we need to have these kinds of questions or feelings? When you look at these things, families can't help but be a little bit anxious about this transition. And so in my experience, when I've talked to transition with my families, it almost feels like we're forcing them from this nice little warm cocoon called pediatrics, and we're throwing them under this bus called adult care. But really, I like to kind of think that maybe they felt this way because there was no preparation. There was no transition for either the families and the adult providers. Because if you really think about it and look at it through the adult provider's eyes, your child may have a condition that they've only read about in a medical textbook in medical school, or have a complexity that they have never seen. And some people, this can be intimidating, right? And some people might rise up to the challenge, and other people, maybe not so much so. So, what can we do? What I did is I wrote a list of suggestions that I've given to maybe some of my families, friends, and individuals. And these are based on my observations and experiences. They're not vetted, they haven't been studied or analyzed, but I do hope that you find that they're sensible and that they're doable. And always remember, what we're trying to do is we're trying to nurture a working relationship with a new provider. But in this process, don't ever forget that nobody knows your body or your child better than you, and that you are an integral member of the healthcare team. Next slide, please. So I would ask you, first of all, to be patient. Your pediatric specialist had many years, maybe 18 years, to get to know you and your family. Please be realistic in your expectations on how quickly your adult provider can get to know you and your family. That being said, do not wait for an illness to be your first visit to your new adult provider. I think that would be just a really bad situation. Try to schedule a well visit. Every insurance company will pay for an annual physical. These physicals are meant to be thorough. So hopefully they'll allot a little bit more time and utilize this extra time to allow the provider to get to know you and your family. I would consider getting a transition letter from either your current PCP or your primary specialist. And don't be afraid to kind of ask for that letter to not only cover past medical history, pertinent medical history, and maybe a list of current medical problems, but maybe touch on things like family dynamics, family involvement, or maybe even successful communication techniques with your adult child. If you do intend on continuing your involvement in their medical care, please make sure any paperwork that needs to get done in order to make that legal is done prior to your first appointment. Now, this is something I tell everybody, because I think this is a skill everybody should know. Please learn your body and practice how to explain it. I always tell people, I think doctors are mechanics of the body. You take your car into the shop, you don't just say it's broken, you explain it. Oh, when I decrease speed to like 30 miles per hour, it starts going ta-dunk, ta-dunk, ta-dunk. Or when I turn off the engine, it makes this clunk sound, right? You explain it, because the more you explain it and the better your description, hopefully the mechanic can narrow it down to like figure out what exactly is wrong. Same with doctors. You have a pain, but what kind of pain is it? Is it sharp? Is it shooting? Is it throbbing? Is it constant? Does it stop? Is there triggers? If communication is difficult, a picture is worth 1,000 words. Take pictures, use video. Keep in mind, the doctor's visits tend to be shorter. So practice trying to learn to be concise. Don't just kind of talk and talk and talk to try to explain something. Be concise. What's wrong now? Keeping your dialogue short and to the point. I've been a dietitian for 31 years. And whenever I want because most of my communication is written, when I want doctors to look at something, I bold it, I indent it, and I bullet it, because I know that that's what they look at. And you might think to yourself, well, how am I supposed to do that? My child is so complex, and I totally get it. In my program, we still have paper charts, and some of my kids are so complex, they have 4 volumes to their medical record. But you might think, really, not all of that might be pertinent to now. And so something I was kind of thinking about that might be useful is especially if your child has more than one specialist, is maybe going to that specialist and asking for a 1 or 2 paragraph summary specific to that area of what happened in the past and what's current. And I think that's something good for you to just have and be aware of. With hospital systems, I talked about how adult hospitals, we have many different adult hospitals. Remember that each hospital has their own electronic medical record, and I am really not sure how easily one medical record can access another. And I don't know how much hoops they need to jump through in order to do that. And for if your child is very complex, that it might be a benefit for people to have more of a central medical record. I know for certain Kapiolani, because Kapiolani's parent company is Hawaii Pacific Health. The adult hospitals under Hawaii Pacific Health, which is Straub, Polymomi, and Wilcox, they share the same medical record as Kapiolani. So if you see a provider at those hospitals, they would have access to their entire medical record. So I hope that this information was helpful. Amanda, if you could do my next slide. So I've kind of just attached my program's brief guide to help you and your child on their path to adult healthcare. It's skill building, and I really didn't even have time to touch on this. So this handout is actually uploaded onto the Footsteps to Transition website, and I hope that you find it useful. Thank you very much for your attention.
Awesome.